Mr. Speaker, and my colleagues before me. It's our first meeting for the new year, so I want to extend best wishes despite the challenges that we face as a nation and as a parliament. Mr. Speaker, what are we asked to approve here today? We are asked to approve a resolution extending the state of emergency for another 90 days. The consequence of which is to provide the Prime Minister with exceptional powers which can be abused. It means the Prime Minister has extrajudicial powers which can be exercised to suspend fundamental civil rights and other freedoms. It is such a powerful transfer of power to the Prime Minister that the Constitution requires that after the Governor General proclaims a state of emergency, the government has 7 days to come to Parliament to approve its extension or it ends. It is not an act that any democratic society readily does or even must ever do, and certainly not to a Prime Minister like ours who cannot be trusted. Worse, we are asked to give this power to the Prime Minister for 90 days. I repeat, for 90 days. Our position on a state of emergency is very clear. It was stated on the 24th of March 2020 in this honorable chamber. We are opposed to a state of emergency. We believe that all the necessary action that needs to be taken to protect lives can be done under existing laws. The leader of the opposition said it then, and here is what I said on that occasion, and I quote, "The most important point for me, Mr. Speaker, is that we have said, and the leader of the opposition said it, that there is a strong body of opinion that we do not need a state of emergency, that every power in the orders can be found under the Public Health Act and under the Quarantine Act, including the notion of restricting movements of people." And I went on, "But the government decides it wants a state of emergency. Again, like we said, we are giving the government all the space to do what is necessary." That is what we said in March 2020. In September 2020, this Honorable House passed the COVID-19 Prevention and Control Bill. We were told then by the government that the bill would contain every requirement needed to control the COVID virus. We were told that it was merely bringing together the things we were doing under the state of emergency. Every requirement was there. That's what we were told. The COVID bill was opposed by us and many other stakeholders, not because of the protocols in the bill, which we generally supported, but we, like other stakeholders, felt rightfully that there had not been sufficient consultation on all of its provisions, and that some of the provisions were a violation of our civic liberties and rights of citizens. And we maintained that the protocols could stand alone. The government argued that it was necessary. It was holistic. Yet today, we are asked to approve the extension of a state of emergency because it is necessary for the prevention and control of COVID-19. But why is a state of emergency necessary? Why do we have to give someone, this Prime Minister, the ability to suspend our civil rights and liberties without consulting us? We have not been told why. Nowhere in his explanations has the Prime Minister outlined a reasonable let alone sensible case for the state of emergency to replace the COVID Act, which we were told had everything needed to prevent and control COVID-19. The Prime Minister says he needs a state of emergency because a curfew is needed. Do we even need a curfew? Do we? So let's examine what confronts us right now in St. Lucia. Truth is, quite simply, we are facing a crisis of unspeakable volumes. After 1 year, the Prime Minister will still say, we are still learning how to deal with the pandemic, while ignoring common sense, the science, the simple things being done by the international community. Just look at the statistics. On December 18, 2020, we had 20 active cases. December 18, 2020, we had about 20 active cases. On February 7th, 2 days ago, that number was 1,097. Over 50-fold increase in as many days. We started off the year with 153 reported cases. As of now, that number has increased sixfold, and we have now passed 2,000 total cases, and sadly, at least 19 unnecessary deaths. And I heard the Prime Minister said this morning that we've only had 1,810 cases. And I wondered whether or not his speech was written quite a few days ago. Those deaths and those cases could simply have been avoided if the Prime Minister and his ministers had put people first. If they had put people first and people's lives first. To paraphrase the Prime Minister, we sadly now have the highest per capita of GDP of COVID cases. To put this in perspective, we have the highest number of cases and most deaths in the Eastern Caribbean. And the member from Saltibus Roselle said about not comparing with Dominica, Antigua, St. Kitts, and not even comparing with Barbados. And I wonder who should we compare with. But let's put it in perspective, where St. Lucia is. Barbados, with 50% larger population than us, has less cases and deaths. And they had a number of super spreader events. Barbados has done over 100,000 tests. We have done about 26,000. Barbados has tested almost 40% of its population. We've tested about 14%. But St. Lucians, I am sure you all remember the chest beating and the boasting in this chamber that we are #1 in the Caribbean and among the best in the world. Every single one of the parliamentarians opposite, from Grosili, Castries, Ancillary, Tannery, Soufrière, Roselle, Mico, Dennery, were bragging and boasting shamelessly, that they boasted that this is the face of success and they are the best in the Caribbean. I remember saying to them then that a basketball game has 4 quarters, a soccer match has 2 halves, and you must never celebrate unnecessarily. More so, this is a public health issue, and no country should rejoice about being better than another country when it comes to a pandemic. They laughed at us. They would not listen. In October 2020, we had about 27 cases. They opened the borders to tourists from the UK and the US when they were experiencing a new wave of COVID cases. Madness, the people said. Uncaring, we in the Labour Party cried. They would not listen. They would boast and they would brag. We begged for more restrictions on those visitors and especially asked to implement a second test. Do you know why we asked it? We had just heard what Mia Mottley, Prime Minister of Barbados, said of the impact of second testing, that 95% of second testers were positive. They laughed and boasted of high tourist arrival figures. And then it hit us. Bam! A spike. The government response was to shamelessly blame what they call a backdoor. St. Lucians entering illegally from Martinique. They even identify a bus driver and stigmatized and vilified him. And then they turned on SLP supporters. And you heard it repeated here today, saying that it was the SLP protest march that was a super spreader event causing the spike. Yet no one positive test was linked to the march. Not one. Even the CMO was moved to say that there was no evidence that any backdoor entry was responsible for the spike. On December 14, 2020, Mr. Speaker, whilst we sat in this chamber, the UK authorities announced the detection of a new variant and that it was more contagious and more deadly. Hear me, more contagious and more deadly. On 14th December, whilst we were in this chamber, and the government continued to boast and boast of tourist arrivals, including from the UK. Little did we know that 12 days later, we'd have the first recorded UK variant in St. Lucia. But they persisted that it was backdoor and the SLP march. But St. Lucians in all walks of life, in all the corridors, the street corners, were whispering that it was the front door causing the problem. But the government boasts and boasts that it was the back door and the SLP march. Everyone knows that the festive season is a time of merriment. It is what we call Tradition Noël. It is a time when people gather and interact. But it is also a time when visitors come to this country, including from the UK, where the new variant was wreaking havoc. By January 2021, the cases are exploding in St. Lucia. Almost 900 cases in January alone. There were countless cases in hotels. The government refused to condemn the violations of its own protocols by some hotels, and the spread continued. Not even in the face of a significant number of cases would the government act. Then a new narrative emerged. St. Lucians are to be blamed for not staying home during the festive season. St. Lucians are indisciplined and must be blamed because St. Lucians are indisciplined, they are brain jackasses, barking dogs, part of the 43%, they're indisciplined, they are mendicants, and they are the ones to be blamed. If only they had stayed home. But meanwhile, the elite is playing golf every weekend, mixing and continuing the merriment. And the government continues to boast of tourism arrivals and high occupancy rates, whilst the people were continuing to be infected and becoming sick, and some started to die. And still the government boasted of tourism arrival figures. So how did we reach here, Mr. Speaker? We are here because this government failed the people of St. Lucia. This government failed to institute proper quarantine and in-country testing requirements for persons coming in from high-risk countries, including visitors and non-nationals. The vast majority of people entering our island never got retested, and visitors were almost never placed in any true quarantine. This government failed when we should have kept measures tight for the Christmas season. When there were rising numbers in the US, the UK, and Canada, the government said everything was under control. We relaxed measures and the economy took priority because they wanted to boast of tourism arrival figures. The government failed to be cautious and take action, banning travel from the United Kingdom to guard against the new UK variant, which was up to 70% more infectious and potentially more deadly. This government failed to take action against hotels, even as the Prime Minister has admitted openly and after the fact. They knew that there were major breaches in major hotels. And even when a hotel had over 60 cases and a death, the government narrative was still that COVID was not being spread from guests to staff. And even after all these events, even after we were told by authorities that they expected a spike in the month of January, we saw no pre-planning, no quick action. In fact, we saw the reverse. We saw the opening of school in the midst of a spike, only to shut down the week after. We saw 3 weeks pass before any action, while the spike continued, the cases increased, and people started to die. And even when they finally announced new measures, they were insufficient, as nearly every sector has been deemed essential. This government failed to ensure that even when the Labour Party persisted in its call for enhancing testing facilities to ensure that we can have an effective testing and tracing program, they failed to approve the rapid tests when the WHO on September 11th published guidance on the use and highlighted the value of those tests in areas where community transmission is widespread. We were told in this house by a member that we were only saying that because there's a business in testing and some people want to make our money. And then the backlog of cases has overwhelmed the testing system. Contact tracing has become restricted to only the closest of contacts. Mr. Speaker, I know the case of a young man who in his workplace, there's somebody tested positive, and he was told he doesn't really have to test because he had his mask, and the numbers are so overwhelming. And then his partner at work started to feel chills, and she said it was the AC. And then she was persuaded to go and get a test. And then she gets a test, and she's positive. And then her partner is also positive. They were 12 days before they get their results to say that they are positive. 12 days. They will not even call and contact trace to have to go on. They took on their own a decision to go and get tested and had to wait 12 days, Mr. Speaker. Think about this. And then the Prime Minister says this morning that the system is not overwhelmed. It is not overwhelmed. Hundreds of people are waiting up to 2 weeks to get their results. This government failed the people of St. Lucia because they did not provide sufficient quarantine and isolation facilities. Again, even when the Labour Party was crying out for monies to be used on COVID-related matters and not election projects, we were told that there was more than enough quarantine facilities with hotels being available, only to learn that these hotels were no longer available and instead they were preparing to receive visitors. It was an indictment on this government that so much money was borrowed, yet no independent state-owned property was retrofitted to quarantine persons awaiting results. Home quarantine has proven to be a disaster. The use of watch and monitors took months to become a reality, and now is not enough and does not really work. 1 year later, we cannot have a contact tracing app to assist the authorities. Our isolation facility is woefully inadequate. despite all the painting of the outside. This government, when I raised the issue of the respiratory hospital, were laughing and boasting. It's the most beautiful it has ever been in its history. And Mr. Speaker, you had to wonder. They totally ignored that the most important thing is not the look, not the bluff and the fluff, but the capacity of the facility. Today, the respiratory hospital is overwhelmed. The secondary facility is also overwhelmed. And home isolation is a disaster with over 1,000 cases. And I'll give another story. Said I always have stories. Of a family, a gentleman whose family called me. He went to OKEU to do an operation, found out that he was positive, and he's convinced he got it at OKEU. And only this morning in Barbados, it was announced how many persons at Queen Elizabeth Hospital, patients and staff, tested positive. In St. Lucia, you never heard those stories, but they are real out there, whispered in the corridors. The gentleman tested positive. The hospital discharged him to go home. An elderly sick man. He's taken to his home against the family wishes, left there. The family had to make calls, and finally he's taken to a certain guest house. The treatment there is poor, Mr. Speaker, but this is what passes for isolation facilities in St. Lucia. Or some people stay home. They are positive and they stay home. This government failed the people of St. Lucia when it still cannot give a proper national vaccination program that goes beyond the provision of vaccines provided through the WHO and the COVAX arrangement. And the Prime Minister made mention of it, that they have vaccines for 20% of the population. But how will the rest of the population be vaccinated? Have they told you, the people of St. Lucia? Why can't the monies that were borrowed by this government be used to buy vaccines? The Labour Party has said, the political leader has said in his 7-point plan, that we would use our diplomatic contacts and sources to get vaccines. And the political leader of the opposition mentioned this morning, Dominica and Barbados will be receiving additional vaccines from India. What has our government been doing? What has our government been doing? Tell the people of St. Lucia how the other 80% will be vaccinated. The 20% is through no exceptional effort of this government. This is part of a global arrangement. So in effect, this government has made no arrangement anywhere in the world for us to get any vaccines. That's the reality. They failed the people of St. Lucia. This government has failed when it decided to use monies borrowed from the IMF for COVID response and to use it for the purchase of incinerators for the managing of garbage disposal. Go back to the estimates. Go back to it, the IMF monies. I heard it's about $20 million. $20 million. Over $20 million. Spent by our broke country that could have been spent on laptops, Wi-Fi for communities, food for the elderly and the poor, medicine for the sick and the invalid. Worse, the landfill in Vieux-Fort was only closed because DSH asked it close. It be closed so they can have a horse race. Clearly putting horses before people. This government failed the people when it did not use money borrowed from CDB to provide support to farmers, bus drivers, fishers, vendors, barbers, hairdressers, and other small businesses. And you had a member from Saltibus Roselle praise his Prime Minister for taking care of the people of St. Lucia. Is the honorable member dreaming? He spoke about missing going by the river and those things. Maybe he should go back by the river. To say he's praising the Prime Minister for taking care of the people of St. Lucia? I can't even go to my barber. Well, he probably doesn't go to a barber anymore, so he won't even know barbers don't open. You know, Mr. Speaker, this government failed to prepare and it failed to act. This cannot be deemed as just a comedy of errors because it involves our lives. People have lost their lives. Mr. Speaker, this can only be described as reckless public policy and bad decision making to the detriment of our people. So where do we go from here, Mr. Speaker? With a pattern of reckless public policy and bad decision making, we are asked to approve an extension of the state of emergency for 90 days. Is this not more recklessness? I have heard the St. Lucia Medical and Dental Association call for judicious lockdown. Yesterday, I heard the CSA call for a total lockdown for a specific period, preceded by an adequate notice period and a package of financial and other forms of support for the most vulnerable. And again, I heard a member from Srozal Salzburg said, we cannot have a lockdown because the businesses pay tax, and if they're not paying tax, we'll have no money to run the country. What has happened to over $500 million that has been borrowed for COVID? What has happened to it? And I'm not going to take him on about his, sinking fund and those things, Mr. Speaker. Let's stay focused, Mr. Speaker. Again, I want to ask, Mr. Speaker, why is a state of emergency necessary? And I'm asking, these are questions being asked to me by my constituents. Is a curfew necessary? I think we all agree that we need to stop the present spike in cases. We need to contain it. That is our number one priority. We are told that the fundamental action required is to break the infection cycle. And to do so, we must dramatically reduce the gathering and interactions between people. So I ask a simple question. If we use the COVID Act to implement all the necessary requirements for a national lockdown, do we still need a curfew? Let us reflect on what the COVID Act provides. Powers to control operating hours for businesses. Revocation of licenses, permits, or any authorization for use of public spaces. Suspension of liquor licenses. Prohibition of assembly. Physical distances. And prohibition of access to any area. If all bars, restaurants, and businesses are closed, if all access to public spaces are prohibited, if all gatherings are banned, if all public interactions are severely limited, then why do we need a curfew? And that's what people are asking. I posit the view that a curfew can always be desirable, but if all other measures are in place, it is certainly not needed from 7 p.m. to 5 a.m. In any event, if we want to restrict all gatherings and interactions, then surely we must focus on when people are mostly gathering and interacting. It is not nighttime. Most of the interactions and gatherings are taking place right in front of us during the day. The present orders are illogical and inconsistent. How can we close SNS but allow call centers to be open? And workers being told not to wear masks when making calls? How can we allow people who are heading to and from the respiratory centers to use public transportation? How can we ask all businesses to close by 7 p.m. but allow some construction work to continue? How can you be asked as the people and blamed for not staying at home, but the leaders of the government are out campaigning and visiting elections projects? There is a simple reason. The government has placed business interests and elections before you, the people, before your lives. The Prime Minister made it clear to us there is no point in saving our lives if we cannot earn money. My people, this government has failed you. But we need a collective pause. We need to take decisive action for a determined short period and stop this spike. We cannot afford a prolonged, relaxed approach for 90 days. That, Mr. Speaker, will only serve particular business interests and the government's desire to enhance its election chances. All the time, our people are suffering and some die. We need, Mr. Speaker, to have a genuine economic and social support program that takes care of our people who are suffering and will be affected. I have come to this House over and over and pleaded for St. Lucians who are affected. More than this, help will be needed. Not just construction workers on road projects. Again, I heard the member from Srozal Saltibus boast of the construction work on roads, and the Prime Minister in his fleeting appearance last night talk about how many more roads have been built. Tell us what percentage of money spent on roads actually go in paying salaries. And I heard the leader of the opposition speak of $20 million for a Rodney Bay road of 2 miles. It's not even 2 miles. It's about half a mile. Between half a mile to 1 mile. $20 million. How much of that is spent on salaries and the employment of people? Tell me, when you spend $20 million on roads and less than $2 million goes in paying salaries, and you want to boast you're doing it for the benefit of the people? And there is a belief in this government that if you help poor people, if you help the vulnerable, then this is mendicancy. You don't borrow money to give away to people. But who gets the money? Who gets it? See, my people, a Labour Party will put you first and seek to protect your life first and then the economy, because the humane thing is to save lives first. This government has no conscience. You, the people, are seen as collateral. They don't care about you. They have failed you. But we must not fail ourselves. We can and we will play our part to safeguard ourselves. This notion that you are the cause of the problem because you are not staying home and that you are indisciplined must be rejected. Let us show that we can do this and follow the protocols. I appeal to you, all St. Lucians, to follow the basics. Wash your hands, wear your mask, and watch your distance. This is the best you can do. Then we will do what has to be done to change this government whenever elections are called. You can only do as much as you can do. The government is failing you and will continue to fail you. But don't fail yourself. After all, according to the Minister of Health, this government believes it is better for them to do the right thing and be wrong than not to do the right thing and still be wrong. I say to members opposite, we are taught that all of our problems arise out of doing the wrong things righter. The more efficient you are at doing the wrong things, the wronger you become. This resolution to extend the state of emergency for 90 days is wrong. Stop doing the wrong things righter. Thank you very much.